in high impacted areas.
Hi, good morning, everyone. The Latinx Business Circle empowers the economic advancement of micro enterprises, immigrant-owned businesses, and underinvested communities. As members of the ALSE Fair Workplace, our focus is Alum Rock and East San Jose, where we provide business training, access to our team of business experts, and referrals to legal assistance. Our outreach efforts have been a mix of social media platforms and in-person touchpoints. Since the shelter-in-place orders, we at the Latinx Business Circle adapted and embraced new service channels. We have facilitated 27 webinars to over 652 businesses on topics such as HR, COVID compliance, and bootcamps on how to move their businesses online. Our team has assisted over 48 businesses with PPP. SBA has funded $585,000 so far. We have provided over 566 hours of individual assistance to affected businesses. We have made over 59 referrals to the ALSE and the COVID navigation hotlines. We have processed over 135 financial aid applications for families in 95116 and 95127. We have worked collaboratively with business services CBOs to ensure all affected businesses were helped, and we co-hosted events with alternative funders and legal assistance teams. We have placed over 79 check-in phone calls to provide resources and information during COVID to affected small businesses. We have connected with over 147 Mountain View food vendors to check in during COVID and offer resources, referrals, and technical assistance. We have also broadcasted Facebook Live informational sessions with business experts, resources, and county representatives. Our frequent touch points with small businesses in Santa Clara County allow us to keep a pulse of experiences and challenges faced by businesses. Some of the most often shared concerns are the fate of their employees, the mounting and overdue rent payments or possible eviction, their inability to meet financial obligations such as equipment loans, and the lack of access to non-predatory capital lending. Uncertainty about the proper COVID procedures for employees and their clients, and the long-term effects of continued COVID on their health of their businesses and our community overall. Thank you for your time.
Great. Moving on to testing. In this response, testing is often when the public first interacts with the county. We heard from the community about their fear about testing stemming from not knowing where to get tested, what the test consisted of, did it hurt, did they need insurance, and did it impact immigrants, whether documented or undocumented. In an equity lens, we are making sure that testing is available to those who need it most and in a way that's accessible by people who look like them and whom they trust. In the county, we have more than 50 accessible sites. Community clinics and state-sponsored programs offer testing 7 days a week with appointment only, either walk-in or drive-through. Additionally, and albeit the most popular, averaging about 800 tests a day, are the county-run pop-up sites. These are especially important for those who do not have insurance, have trouble navigating online signups, need access to these services in their neighborhoods, and with the lowest barrier possible. Using local case data, these locations are selected in the areas most in need. Weekly, there is a site in East San Jose, one in Gilroy at Outbreak work sites, and rotating city sites. City sites are the only pop-ups by appointment only that facilitate access to those who work specific work shifts and need to access testing quickly. For all except cities, no appointment is needed. Day and evening hours are available, and Saturday hours are available. We ask as little as needed on the test forms. There are multilingual community navigators at sites to interpret forms and support through the process. All who are tested are given follow-up information in their language of preference, and test results are given over the phone, via email, and postal mail in all languages as well. I'd like to give thanks to our DESJ staff who are working with the testing team on site, and to our graphic designers who create wonderful, effective images every week for all pop-up sites in all of the county translated languages, and all the additional testing support materials that we share with ethnic media and for targeted outreach efforts. Now I'll hand it over to Imelda Bautista, who will share more about community efforts with testing.
Hi, good afternoon, everybody. Do you hear me?
Yes, we can. Thank you.
Okay. Hi, good afternoon, Board of Supervisor of Santa Clara County. I am Imelda Bautista, co-founding partner of Meta LLC. partnership composed of 11 women workers dedicated to the community that make difference, empowering their members to develop their sufficiency skills. I have been resident in San Jose by 17 years, and I've been a mentor of promoters of Valley Palms Unidos Association by 3 years. I am proud a mom of 3 children. One just graduated for Bellamy in 2020, and my 2 little ones are studying Dual Immersion Academy in Alhambra District, where I have served as a volunteer for more than 13 consecutive years, and where I facilitate reading circles for the student of Lucha, Cesar Chavez, and Adelante 2. Currently, I am part of the active of Si Se Puede Collective, and I am part of the volunteers and workers who is helping in a COVID-19 pop-ups. And I am working volunteer there for, I think 2 months ago. And also, I am helping the community, giving the information they need, and also give meetings, virtual meetings today, information about the process of the resources that the county of Santa Clara give us to the people have a positive test. And also I was helping in Overfell, Andrew Hill, San Jose, Oak Grove High School, in the Bergen County offices, Sub Center, and San Antonio Elementary School. I help in besides putting the forms on the clipboards. I sterilize the clipboards and pens. I direct seniors to the short line. I translate to speak Spanish speakers. I have the traffic flow in the internal, external lines on the sites. I help them to raise necessary information to the virtual informational meetings, where we give them the location of the sites and the resources that county offers to the people. And I think Meta and Si Se Puede Collective, Somos Mayfair, and other agencies work together with the county, and we can work to go ahead and fight this COVID-19. Thank you.
Thank you very much, Olivia. Critical to operationalizing a racial equity lens. Next slide, please. Thank you very much. Critical to operationalizing a racial equity lens across the COVID continuum is the engagement of the communities we aim to positively impact through our work and partnerships with community-based organizations. I would like to highlight 3 efforts currently underway that aim to establish the infrastructure for a racial equity focus to the county's contact tracing efforts. The first is building a county multilingual, multicultural contact tracing operations. To date, this is inclusive of preferential recruitment of volunteers and reassignment of county workers with additional linguistic and cultural knowledge to best match the needs of our communities. The posting of paid positions for contact tracers with specific cultural knowledge and representation of affected communities, and recruitment through our community partners who have deep connections to communities of color. Racial and health equity trainings for our contact tracers. Improve data collection and enhance understanding of COVID-19 impact on communities of color and LGBTQ communities, and the engagement with key leaders in communities of color for ongoing feedback to the current contact tracing efforts and plans to address their concerns. The second is the implementation of a community health and business engagement team, a community health worker model that will center its work on communities most impacted by and vulnerable to the COVID-19 crisis. 3 coordinating agencies, Somos Mayfair, Roots Community Health Center, and Community Health Partnership, will support contact tracing efforts by supporting with navigation, connecting positive cases to appropriate services, housing, follow-up care, financial assistance, and warm handoff to service providers. The third is our targeted promotion and outreach that will complement and extend beyond our existing platforms to ensure that messaging is reaching communities impacted by COVID inequities. A grassroots strategy is underway with our community health workers to address the mistrust, misinformation, and fear connected to contact tracing in communities by trusted community leaders and messengers. I would like to now turn to Olivia Ortiz. She is a promotora and founder of Mujeres Empresarias Tomando Acción, Meta, a key partner of the Si Se Puede Collective, who will be leading our COVID community engagement and outreach efforts in East San Jose.
Ana Lilia. Hello, everyone. My name is Olivia Ortiz, and I am part of the Meta LLC, a worker-owned cooperative established 4 years ago with the initial investment of Somos Mayfair. Our work brings institutions closer to the communities they serve and create more opportunities, authentic community engagement. We will be part of the Si Se Puede collective campaign by supporting on the ground, testing efforts and sites, and connecting our community needs to provide support systems. More than ever, it's important to develop and promote messaging that speaks to us and bring relevant information and resources. There's a lot of need in the community right now, but there's also a lot of fear and mistrust. There's no one better than us who are part of the community to break these fears and mistrust. By being part of the Si Se Puede collective campaign, promotores will help to create a vision of the work, develop connections and relationships between the community and the county, which is very crucial at this time. But we also intend to push and not let the politics out of this work. Let us save lives in the most impacted neighborhoods in San Jose. Meta is very proud to be in partnership with all these organizations and to work together for the well-being of our most vulnerable communities, because we are part of the community. Thank you for your support.
Thank you very much. Next slide, please, Dr. Smith. Besides the work that has been happening at the Emergency Operations Center, the Division of Equity and Social Justice has also worked not only within the agencies of the division, but other parts of the county to address the needs of the community at large. And now we want to talk specifically about how we have done that by focusing on the actions that we have taken to address the needs that members of the community face at home, in the workplace, and in the community. So with that, I will turn it over to Carla Collins so that she can begin with a discussion of how we have helped people as they're sheltering in place at home. Carla?
Thank you so much, David. And if we could go to the next slide, please. Great. So we all know this. Sheltering in place is really hard. It's hard on families in the very best situations, but for many, it's downright dangerous. Our division has done some great things to support children, to support working parents with legal protections and worker rights, and to support and address mental health and trauma with personal connection, system impact, and response. So I want to highlight just a few. Consider OWP supplying women at Elmwood with safe paper activities and snacks, as all programming there has ceased. And OCC and their work to support childcare for essential workers and language access to families by our UAP staff. And then there's OIR's trainings to understand public charge, 51 of them during sheltering in place, and the 3,500 people who have received legal services during SIP to adjust status and increase protections. Consider Office of LGBTQ Affairs and their innovative work with both Avenidas and the LGBTQ youth space, create a new intergenerational LGBTQ pen pal program. Of course, I don't think there are any more vulnerable than those who must shelter in place when home is simply not safe. So to address sexual assault, human trafficking, and domestic violence, we are forced to deal with what is quite literally a pandemic within a pandemic. No surprise, we saw an initial decline in calls for support with law enforcement at our hospitals, even with our CBOs. And sadly, many of these first responders have all noted calls as far more brutal and severe than what they typically see. But this keeps us working hard to ensure that everyone who needs it has access to emergency shelter, and we've expanded tools like Safe Chat SP to connect survivors with an advocate via text. We did county Facebook Live briefing in April on resources, and it had thousands of views. And as calls for help are returning to typical pre-COVID levels, we know we will be dealing with the impacts of sheltering in place for years to come. We must continue to support and fund our local CBOs. We must increase our flexibility to meet clients' needs. And we must continue to ensure that communications are culturally responsive and gender inclusive. We can go to the next slide, and to speak more about our partnerships and the hard work ahead, it's my honor to turn it over now to Erin O'Brien, Executive Director of Community Solutions.
Thanks very much, Carla. I'd like to share with you today a little bit about the services that we've provided to the survivors of, as Carla mentioned, intimate partner violence, sexual assault, and human trafficking during the time of the pandemic. And as Carla said, after the public health crisis was declared, we initially saw a significant reduction in the number of victims reaching out for help, which was absolutely predictable, but very troubling. And with funding provided by the county and through the Office of Gender-Based Violence Prevention, we increased our outreach efforts through multiple channels to ensure victims were the services that stayed available to them. A few of the strategies we utilized: in April, we participated in multiple Facebook Live events in both English and Spanish, where we reached a little over 2,500 individuals to inform them about available services, warning signs, helpful preventative tips. In May, we launched PSAs on both Spanish and English radio stations, reaching over 117,000 individuals. And in June, we had created and we were ready to launch informational videos in Spanish and English on intimate partner abuse, sexual assault, and harassment. And we had nearly 369,000 individuals view at least one of our videos, with the videos being seen over 600,000 times. Towards the end of May, the downward trend of survivors reaching out for assistance reversed, and since then the volume has increased. And unfortunately, the acuity and lethality levels of cases have also increased. So aside from the violence perpetrated against them, the victims and survivors are really in desperate situation with COVID and with financial crisis that's also plaguing them. So thankfully, the Office of Gender-Based Violence Prevention worked directly with us to ensure that the funding was flexible and could be utilized to meet the emergency housing and financial needs of the community we were serving. And through their flexibility, we were able to provide hoteling or long-term stays for survivors of gender-based violence who needed a safe haven, as well as assisting them with meeting their most pressing financial needs for transportation, food, rent, and other necessities. So we are all aware of the disparate impact the pandemic has had on people of color and people in poverty, and we are committed to doing all that we can to mitigate this. And grateful that through our work with the Office of Gender-Based Violence Prevention, we've been able to maximize outreach, engagement, and services to survivors. And so on their behalf and ours, we thank you.
Thank you. Next slide, please. I just want to add to the previous presentation that our public service announcement video made for the Vietnamese community about intimate partner violence services and resources received 17,000 likes, 3.7 thousand shares, and 4 million impressions in Vietnam. So the video went viral not only here in the county, but also in Vietnam. We're very proud of that, but also continue to be concerned by the need for these constant existing need for these services. I will now switch. This is Betty. I will now switch to my OLSE hat to present services and supports in the workplace. So essential workers such as grocery clerks, janitorial service providers, and those in the retail food sector are predominantly from communities of color and immigrant communities. They are low-wage workers and workers who have not had the option or privilege to not work, to deny work at the risk of losing their jobs, and are not able to shelter in place, and often challenged with isolation when they go home to multi-generational households in densely populated communities such as East San Jose, the Mountain View Corridor, and pockets of South County. Our vulnerable worker populations are among our most COVID vulnerable populations. Even though the DESJ has an office dedicated to vulnerable workers and businesses, all DSJ offices have responded to worker needs during the COVID response. For example, the Office of Gender-Based Violence Prevention revised multi-million-dollar contracts to respond to and provide services and additional support to families impacted by mass unemployment and underemployment. The Office of Immigrant Relations supported the creation of the Undocu Fund to support undocumented families and individuals ineligible for public benefits and assistance because of their status. The Office of Immigrant Relations ensured that DACA status did not lapse during this time, allowing DACA recipients to continue working and not be forced to participate in the underground or gray economy. Next slide, please. I will now turn to Jessica Vollmer, our community partner, representing the Fair Workplace Collaborative.
Thank you. So the Fair Workplace Collaborative, as a reminder, is a cohort of 7 partner organizations that have been focused on training workers and small business owners on rights and regulations in the workplace related to a number of federal, state, and local labor laws. So these are partners who have language capacity in Spanish, Vietnamese, Tagalog, English, Punjabi, Hindi, Visayan, and Mandarin. And we are running a number of programs related to COVID response to ensure that workers and small business owners have access to the information that they need in order to stay safe. So one of the programs that we have started is the CAN-19 hotline through OLSE, which is the Assistance Navigation Hotline. It's a hotline staffed with 40 navigators who assist community members in navigating the income and social safety net resources they need to make it through our shelter in place and public health order. And also directly connects those community members to the legal advice line of OLSE or social safety net service providers. As of Friday, we have had 23,000 conversations with community members, helping them navigate those systems and connect them with those resources. And our language capacity is in English, Spanish, Vietnamese, Cantonese, Mandarin, and Tagalog. We are also going to be launching the Tibet Business Engagement Team. On Monday, this is a program that will have 27 in-person outreach navigators in the field going to workplaces to ensure workers and small business owners understand and are following the protocol under the public health order. The priority locations for the business engagement team includes the 5 zip codes that have been the most impacted by COVID-19, places of concern or where reports have been made that protocol are not being enforced, and business districts including downtown San Jose and Mountain View Castro. The location prioritization will be dynamic and responsive depending on where it is identified that outreach is needed. We also have the Fair Workplace Collaborative work, the LSOEI and Food Permit Program, which is work that we are continuing to do with our small business and worker outreach partners. Again, those include the Vietnamese American Roundtable, the Step Forward Foundation, the Filipino Association of Workers and Immigrants, Day Worker Center of Mountain View, Working Partnerships USA, the Enterprise Foundation, and the Latinx Business Council of Silicon Valley. We are focused on trainings and worker and business outreach and engagement, and we have shifted to COVID response to include in our trainings rights and protocol for workers and businesses under the public health order, as well as providing advice and resources to small business owners about things like how to restructure their business model in order to survive COVID-19. Lastly, we have the OLSE Legal Advice Line, which is staffed by 7 attorneys from the Step Forward Foundation. These attorneys, that's staffed by attorneys through the Step Forward Foundation. These attorneys speak 7 languages, including English, Spanish, Vietnamese, Tagalog, Visayan, Punjabi, Hindi, and Mandarin, and are providing legal advice to workers and connecting workers to legal resources to navigate workplace violations, mostly focused right now on violations related to the public health order, and small business owners to the legal resources they need to ensure they are compliant. To date, the legal advice line has fielded 3,592 calls. The majority of those have come in while we've been under the public health order. And the last piece about this is that the legal advice line is also now serving a dual purpose as the COVID-19 workplace reporting line, where workers can report public health order protocol violations.
Thank you, Betty and Jessica. Next slide, please, Dr. Smith. The DSJ is rooted in the community by collaboratively supporting all residents to thrive in the county. In the last year, the division has honed the equity lens by offering consistent, adequate, and relevant information and resources on a range of issues that support families, including access to universal preschool, workers' rights, immigration legal services, and LGBTQ inclusive resources. All of this work has laid the foundation for the DESJ's unique contribution to mitigating the impacts of COVID-19 in the community and bringing equity to action. Since March, DSJ utilized its core competencies and deployed an aggressive 4-pronged approach. First, public information in multiple languages to reach the hardest to reach residents. This includes utilizing all forms of communication, and we are proud to say that we have offered daily content on COVID-19 in language and across the county. Secondly, direct community education. Our division continues to respond to the emerging needs.
This is so to the community members and the Board of Supervisors. I wanted to introduce Celica Rodriguez, who is the new head of the Office of Immigrant Relations, and she was previously at Somos Mayfair. Celica?
Yeah, thanks, David. Thank you for that. I should have started with that. Thank you. Secondly, we are still offering direct community education. Our division continues to respond to the emerging needs of the community and developed a robust community resource sharing system that vets, aligns, and distributes resources far and wide. Thirdly, we continue to build community connections. We're still doing the work that each office was tasked with before COVID, work that we believe will continue to propel us into recovery. We continue to celebrate Pride. We strive for a safe and inclusive county for LGBTQ community. We're offering public charge presentations to ensure that immigrants understand that they can access emergency services during this national disaster. And we're working with shelters to ensure that our violence survivors have a place to self-isolate, and so on and so forth. On top of all of this, we continue to support and promote everyone's rights and responsibilities. Now more than ever, we emphasize that everyone, no matter socioeconomic status, immigration status, gender identity, who we love, or what we do for a living, has the right to be counted and contribute to our democracy. It is due to our strong and unwavering investment and presence in the community that we are able to build authentic trust, build resilience, and reimagine a more just and equitable future. Next slide, please, Dr. Smith. To speak to the work on the ground in the Eastside community, it is my honor to introduce Jackie Franco, a strong community leader and co-chair of the East San Jose Peace Partnership. Jackie?
Good afternoon, everyone. My name is Jackie. I am the co-chair for the East San Jose Peace Partnership. Peace stands for Prevention Efforts Advance Community Equity. We are a group of residents and organizations that came together 4 years ago to address root causes to violence and trauma in East San Jose. With over 30 partners, including our co-chair, the Department of Public Health, we have developed a strong framework that puts us residents at the center of the work to find and lead solutions that will result in sustainable change in our neighborhood. It has been because of our relationships, collective strengths, and assets and commitment to the East Side that we have been able to support families during COVID-19. On April 5th, we activated the partnership to respond to COVID by meeting with Dr. Clara Co to communicate to her the impact of both shelter in place and COVID on families in East San Jose. This was the very first of many opportunities to share with the EOC and public health of our most pressing concerns and recommendations for actions. We have worked on co-developing communication material for testing and the distribution of messaging materials, have provided support and work at testing sites, have hosted virtual community meetings to hear from East San Jose residents most impacted by COVID. Critical to this response, the Peace Partnership has been able to support families in accessing financial support. Within a month, we established a COVID relief fund and have prioritized families that aren't eligible for stimulus funds or unemployment, who are low income and reside in East San Jose. $255,000 were distributed to support over 186 families. And although it is a small pot of funds, we know that we have been able to humbly contribute to the survival of families during this pandemic. We know that the best strategy to stopping this pandemic is to work together, ensure that our families have the resources they need, support the recovery efforts so that our families can get back to work safely and reach the hardest to reach families. We acknowledge and uplift Santa Clara County's leadership in ending this pandemic, and we want to continue to partner to address emerging needs and recovery efforts to support thriving communities. Thank you.
Thank you, Jacqueline. Next slide, please, Dr. Smith. And welcome to the team, Zalika. Team DSJ is proud to have you. My name is Pratima Pandey, and I'm from the Office of Women's Policy. What do we do when the finish line keeps moving? Well, I'm here to tell you that Team DSJ is going to work with all of the marginalized communities to continue to deal with the challenges that our communities are facing right now and will face during recovery. Team DSJ is part of the recovery planning strategies for the county. We are preparing and shoring up our community-based organizations as well as other stakeholders in dealing with what our communities will have to counter as they are recovering from the pandemic, starting from all of the struggles that our families are feeling at this moment, going on to the job losses that our communities are seeing. As we saw in May, the Clayman Center for Gender Research at Stanford introduced a report that said 55% of the unemployment is being faced by women, and 2/3 of those women are working in low-wage jobs. We heard from the manager of the Office of Gender-Based Violence Prevention about the survivors of domestic violence who will need help during the recovery, not only now, but also to come out of this pandemic. We are also concerned about our communities that will have to face discrimination in the workplace. Our Office of Labor Standards Enforcement is continuing to build on the trust that has been generated in the community by the work that we're doing to support our vulnerable laborers. Our migrant communities rely on Office of Immigrant Relations and the work that we have been able to do to support them right now and will do as we are recovering from the pandemic. With the elections right around the corner, Office of Women's Policy is also shoring up to ensure that everybody's civic rights are protected, promoted, and preserved. As we look to the recovery that our communities that live in the margins have to face, we must remember that the trust building that began with the Division of Equity and Social Justice is what the county can hope to continue to build upon, so that every individual who calls our county their home is able to live in our community in a healthy and productive manner. For us, the work that we do at DESJ is not possible without the critical support of those who are on the ground. You have heard from some of the partners, and I'm going to turn over now to Dr. Bauer, who's the superintendent of the Alum Rock Union School District, who has worked closely with Dr. Arcel Blume of the Office of Cultural Competency with our Universal Access Partnership Program. Dr. Bauer will talk about the recovery and then turn it over to Nick Kuwada, who is the manager of the Office of Census. Dr. Bauer?
Thank you, Protima, and good afternoon, everybody. It's really a pleasure to be here talking about good things, which is the recovery, right? And also sustaining our families through these very extraordinary times. The program in collaboration from the Board of Supervisors has been truly key to the survival and continuity of our community. The Universal Access Pilot started as a little mustard seed, has grown into a huge, beautiful tree, and has provided the respite that our families needed. 5 years ago, when the Universal Access Pilot was presented to the board, we saw the kind of expansion and support it has provided to our community in Alum Rock. During the COVID situation, we have worked through our family resource centers that have been able, through a number of interweaving of budgets with community organizations, the district, the Board of Supervisors, the city to some degree, and the county office of ed. So we are an example of true collaboration on how to support our families through kind of regular times. What does those look like? We don't know that anymore, but truly through these very extraordinary times. We have worked to provide support families in necessary resources, including utility assistance, rent assistance, social services, emergency housing, legal aid. We work within the structure of the UAP to support with the collection, distribution, or referral for basic necessities for our students and families, such as the diaper distribution that very needed for the families, and food. In collaboration with the city and the food bank, our family resource centers have been now the hubs for the distribution of food to our community. When the district staff is up, then food bank staff and volunteers for many community-based organizations come and continue providing the nourishment for our families. We have also worked in organizing and facilitating weekly meetings to gather information regarding the needs of our students and families in real time, coordinating meetings between various stakeholders such as county behavioral health and ourselves to plan the continuous support throughout the summer, and now that we're about to reopen classes for the school year 2021. And I also want to thank the Office of Emergency, and please forgive me, I'm very bad with the names, the Emergency Operations Center. And I have to highlight this to all of you supervisors, because this was truly an amazing, it started as an experiment, and then everybody started kind of copying it. And I want to say thank you very much, County of Santa Clara, for providing that. The idea was to provide COVID-19 information in real time for families in their own language. So we hosted, in conjunction with the Emergency Operations Centers, 3 town halls, 1 all in English, 1 all in Spanish, and 1 all in Vietnamese for families with real-time information about COVID-19 at the beginning of June. So thank you very much for that support. That was amazing. It taught us all that people really welcome to participate through many different ways in their language. And we were able to provide that very needed information to our community. So thank you very much, and I hope to continue this tremendous collaboration with our community. Thanks. I think Nick is next.
Thank you, Dr. Bauer, and thank you to the distinguished board, members of the board for this opportunity. As my colleagues have already stated, and as our community partners have demonstrated, DESJ plays a cornerstone in the county's work to bring vulnerable communities together, get them the services they need, a role that is even more important during this pandemic. This is not a time to step backwards. This is not a time to reduce investment. We have to invest more to capitalize on the community relationships we've made and the knowledge that we've acquired to this point. We need to give all communities a hand by engaging them directly with our offices within the division and the county infrastructure that can assist them with their needs when those needs are the most dire. This is why we propose the formation of an Office for Community and Civic Engagement. Census was the foundation that allowed us to form partnerships within the county and with county partners all across the board. We have a dream team of community-based organizations that have come together to make census a priority, and we know we can do that for other projects as well. Things like keeping communities of interest together during redistricting, facilitating culturally respectful engagement with residents to register them to vote, and encourage low-propensity voters to learn about local issues. Facilitating and providing access to county and city leadership to discuss pressing issues by providing training and support through grassroots organizations who specialize in advocacy. And developing a pipeline for our local youth to become leaders, the next generation of leaders. This office must also play a pivotal role to engage and give special techniques around census data to every office within the county so that we have the eyes and ears that we need to give equitable and accessible services to every member of our community. We will provide up-to-date material. This information is updated all the time through American Community Surveys, etc., and is not always the easiest to access. We would provide that specialty. Now, I would like to pass it to Ann Im. She's the Immigration Program Officer at the Silicon Valley Community Foundation, who's been a longtime partner for a lot of these organizations and actually is a bit our point of contact for the census. So, Ann, take it away.
Good afternoon. My name is Ann Im, Immigration Program Officer with Silicon Valley Community Foundation. Our foundation has long provided funding for organizations that serve our most vulnerable communities, which includes support for immigrants, as well as strategies around civic engagement, the 2020 census, among others. We partner really closely with this division, which works with communities that have been most negatively impacted by COVID-19. If it weren't for the vision and planning of this board to invest in this division in the first place, I think we would truly be in an even worse position today. The county has been at the forefront of fighting back against anti-immigrant rhetoric and policies, responding to attempts to add a citizenship question to the census, and battling executive orders to remove the undocumented community from the census count. This division and the network of organizations that it partners with provides a safety net for the community through a racial equity lens. At a time when racial and economic justice are top of mind for everyone, any reduction in funding for DESJ or for the community-based organizations that it partners with would just simply be devastating for the community. And if anything, I truly believe that support should be increased at this time. We also support the creation of an Office of Community and Civic Engagement that will allow the county to build on the foundation that has already been established and ensure that there is a county office that's truly connected to the community, which is often distrustful of government. As a county resident, I'm really proud that our county is a leader and model for our region and the nation. And this division represents the heart of Santa Clara County and will be instrumental in addressing the challenges that we face in recovery. Thank you.
Thank you very much. And next slide, please, Dr. Smith. Good job with the slides, by the way. So as we conclude our presentation, we just want to highlight a couple of points for consideration by the board. As was noted, we believe that the work of the Office of the Census has been instrumental not only in moving forward the response rate, which is one of the highest in the state, but also in developing and enhancing relationships within the community. And we believe that we should follow the example of other jurisdictions that have used the work around the census to actually develop an agency responsible for civic engagement. And so the idea is not to create something new, but to really restructure this office so that the work continues. Likewise, we know that there is a consideration of a possible adoption of an equity pledge. If the board decides to do that, that will also have implications in terms of how budgeting and other decisions are made. But the bottom line is that we believe that this is the time to invest further in these communities, and that investment not only needs to happen to respond directly to the COVID pandemic, but as we move forward with the recovery. And we would end in the next slide, please, Dr. Smith, and simply note the stated mission statement of the County of Santa Clara, which is to plan for the needs of a dynamic community, provide quality services, and promote a healthy, safe, and prosperous community for all. We respectfully submit that cannot happen unless there is an equity lens, a race and justice equity lens to look at those issues. With that, we conclude our presentation from the Division of Equity and Social Justice, EOC, and we'll turn it over to, I think, our health director, our public health officer, Dr. Clara Co.
Thank you. And I do want to just say a thanks on behalf of the board. We're going to listen to a whole nother presentation. Those of you who can stay, please do. And for questions, and those of you who can't, we'll rely on the staff to respond. So thanks, everyone. Dr. Cody?
Thank you, President Chavez and members of the board. Good to be with you as always. I'm just going to start with a brief overview of where we are in the local epidemic, and then that will be followed by updates on testing from Dr. Fensterscheib, on case and contact tracing from Dr. Rudman, and an update on our local hospital system and capacity by Dr. Kamal. So first slide, please. So this again is the epidemic curve that shows the epidemic in our county, starting with our first case on January 22nd, and these show the cases through August 9th. I want to note that to the far right, those cases under the red block after mid-July, these data still remain under review. As many of you know, there was a issue with the state's reporting system and a backlog of data. We believe that the state has told us that the backlog issue has been fixed and the cases have gone out to the counties. I want to publicly praise our team, including Dr. Pam Stoddard and her data team, and Grace Alderson from Public Health Operations, who did an absolutely spectacular job over the weekend, bringing all of these cases in. And so that you can see there in orange under there the new cases that populate our epidemic curve from the backlog. I do want to just highlight that we are continuing to perform some validation studies to ensure that these data are complete. We think there may be still a little bit missing, and we'll know for certain in a few days. What you can see with our epidemic curve, again, is that after we issued our shelter-in-place order in mid-March, we were down to really just a handful of cases on some days in May. And then in early June, our cases began to pick up. They reached a high of over 350 cases a day in mid-July, and now seem to be coming down somewhat, although they are stabilizing at a very, very high number of around 250 cases per day, which, as you know, is more cases than is safe. There's still widespread community transmission, and we're not able to do some critical things in our community, such as ensure that everyone can benefit from in-person learning, among other things. Next slide. This next slide shows, again, the cases among long-term care facility staff and residents. The residents you can see there are in the yellow, and staff cases are in orange. And what I want to point out is that while these cases proportionately are smaller than they were in April when we had large outbreaks, you can see that as community transmission increases, inevitably we do have increases in cases in long-term care facilities. Similar to the pattern that we saw in April, it's still the case that more often than not, the initial case is in a staff member and then spreads to residents in the facility. But all in all, I would say that we're doing a remarkably good job at keeping our long-term care facilities as COVID-free and as safe as possible. Next slide. As far as who is getting sick from COVID in our county, there's a couple of trends that have been present for a while and still hold. The first of which is that it's a higher proportion of cases among Latino residents in our county than expected, given their proportion of the county's population overall. And this proportion of cases among Latinx residents is actually increasing. It has been increasing over time and now represents 61% of all cases over the past 3 weeks. And that's as compared to 22% Latinx residents in our population overall. What is not shown on this slide or other slide is where those cases are. And I think we've shared this earlier, but the trends also still hold in that we're seeing the highest case rates in East San Jose and in South County, particularly in Gilroy. Those are where the highest rates are, and why the work that you just heard about in the presentation from Dave Campos' group is so important to our community in being able to address COVID-19. Next slide. The second trend that's been holding true in our county as well as in other communities around California is the higher case rates among young adults. And I recognize this slide is a little bit busy, so let me just walk you through. First of all, to the far right, those data in the box are a bit incomplete, so maybe don't look at those. But what I want you to see is that over to the left in May, all the lines kind of come together. In other words, the case rates by age group were fairly similar. But then in June, the case rates among the young really began to take off. And so it's the green, the turquoise, and the yellow lines, which are sort of tangling up there near the top. Those represent cases among 18 to 34-year-olds. And what you can see is that those case rates are both increasing and higher than the rates among other age groups. So this appears to be where the epidemic locally is especially accelerating. Next slide. I also just wanted to share with you our data on deaths. So a little update to this slide. As of today, August 11th, there have been 207 residents of our county that have died of COVID-19. And of those, 43% were among residents who are living in long-term care facilities. So there on the slide, you can see that the blue bars represent deaths among people who did not live in long-term care facilities, and the green bars are deaths among people who do live in long-term care facilities. And again, overall, 43% of the deaths in our county have occurred among long-term care facility residents. So if you remember back to the original epidemic curve, you know, we do see that the proportion of our total cases that have severe illness and that are resulting in death has decreased over time. And in fact, our death rates are lower than those of many surrounding jurisdictions. But the bottom line is that we still are seeing preventable deaths from COVID-19. These are family members and friends who have died, and they're with leaving grieving families behind. And ultimately, they are preventable, and we can prevent them if we continue to come together as a community. Next slide. This is just the last slide that I'm going to share before passing it over to Dr. Fensterscheid, but I wanted you to see how our epidemic is reflected among hospitalized patients. So this shows the trend over time of the number of people hospitalized with COVID-19 in our county. They include both our county residents as well as residents of other counties who are hospitalized here. And what you can see is that, one, over the last few weeks, the number of patients hospitalized has remained somewhat stable. It is not continuing to increase. That's the good news. However, the number of patients hospitalized is about where it was when we peaked in April. So we are continuing to work to limit the spread of COVID in our community and ultimately ease the number of people who require hospitalization. And I'm going to, with the next slide, pass this to Dr. Fensterscheid.
Okay, thank you, Dr. Cody, President Chavez, and members of the board. Could I have the first slide? So slides are slides that appear on our dashboard. So you've seen these before. I would point out, though, again, on the extreme right side of these next two slides, really show us that we had some issues with data, and again, we're waiting for validation of some of those results as they affect cases. So they also affect our testing information. Let's go to the next slide. Here is a 7-day average, and so you can see the dip even more so on this. And again, it's probably a mixture of a number of things. Again, some of it may be the state data issues. We also noted that in our pop-up sites, we had some people who were not coming to our Gilroy site, so we had a decrease in those numbers of people there. We also had switched over to some wristbands, using that as a way to keep people from having to wait so long. So that transition caused us to decrease a little bit of our testing for a short time. So we'll see over the next several days what those numbers look like. I would point out, though, that red line that stops where the red bar, where the red shading area is our positivity rate. And again, it's looking like on the whole in Santa Clara County, we're looking at about a 4.2% positivity rate. That includes all the testing that we have been doing. Let's move on to the next slide. In this slide, we're looking at people who have been tested in Santa Clara County as a whole. So all the testing that's been done by any provider. And we're looking at areas, specifically the geographical region. So if you look, you can see East San Jose, South County, and the other remaining zip codes. What you see is that, number one, in this period of time, which is, again, July 18th to August 7th, it's a 3-week period, so it's a snapshot in time. The total number of tests that were done in the entire county were 85,688. And of those, again, you can see the breakdown of where those people lived that were tested. There's also a percent that you can see, such as in East San Jose, where 19% of all the tests that were done in East San Jose, and then you can follow the numbers down that particular column. I would point out also that, as I mentioned, the overall positivity rate of a bit over 4%. When you look at certain areas, as we've talked about previously, in the some of the vulnerable populations, in East San Jose, we have the highest rate of positivity of 9.82%. And again, this is a snapshot, so it does change as our data changes. And also in South County, 7.13. So those areas represent areas where there is a much higher percent positivity than in the overall county. There are a lot of unknowns, and if you may ask about why so many unknowns in that's because we didn't have any identifying or addressed zip codes for those people. Let's go to the next slide. So as that last slide was all the testing we've done, this is going to show more of the testing done just by the County of Santa Clara's health system. And the first bar up there shows a number of 32,765. That represents, again, during that same 3-week period, all the tests done by the county system. And that represents 38%, so over a third of all the testing that's done in this county is done by the county health system. If you look down, we're going to then break it down even further and show all the testing that's done by our pop-up sites. So you can immediately look down to the total, and it says 27,096. And again, that's the percentage, that's the number of tests that we have done within the pop-up sites. And that's about 83% of all the testing that the county does is in the pop-up sites, which again, if you want to really look at the numbers, it's about a third of all the testing that's done in Santa Clara County just in our pop-up sites. So again, the difference here to look at is that the areas that, again, are hardest hit and we're most concerned about as far as the high positivity rates, we have spent a lot of time. This isn't the people tested, but this is the amount of time that we have been present in those communities. So again, we have been in those communities 36 and 31% East Side and South County respectively. Okay, let's go on to the next slide. And the final slide, well, the final 2 slides of our dashboard represent the testing that's been done by the healthcare system in the past week. Now, this is a week representation from July 27th to August 2nd. So it's just, again, a snapshot in time. And this is showing all of the systems that are doing testing. The county system is listed first, and then you can see Stanford, PAM, Kaiser, El Camino, and HCA Healthcare. So on the left is a bar graph, which is showing, again, the rates that these tests are being done by these providers. And again, rate is the amount of testing done per the population served. So for instance, Kaiser has 600,000 members that they serve in this community. So we will look at their testing and define the rate as the number of tests they do per their population. Again, we'll stay on Kaiser for a minute because that number is quite low, which added to that dip that we saw in our testing, and we were alerted that Kaiser during that time was working on a very large backlog of testing that they were doing, and so during 1 week, and again, it's not necessarily this exact week, but they were not doing any testing. They were basically testing the backload of cases that they had. They needed to finish those before they continued on, so they had stopped testing. Let's go to the next slide. And this is a busy slide, but this is trends, again, that represent the same testing that was in the previous slide. And again, this is since the beginning, early June, and then through August 9th. And again, if you just look at the area from July 27th to August 2nd, if you just see that area on the right, it's in the red area, but that's the area that I provided the information, and that was what the dashboard previously exemplified. So again, decreases, and some of it we can explain. A lot of it, again, may be again related to the data and the state's delay. Let's go to the next slide. I think we previously talked in the previous presentation a little bit about where the testing sites, and I know there's sometimes questions about, well, where are all these sites, and do I need an appointment or is it walk up? We broke it down, and these are the county sites now for the most part, and the 2 state sites. So for instance, we have 2 pop-up sites, and those are in the east side and South County, and they are walk up. No appointments are necessary, and we give people wristbands. We're doing testing from Tuesday through Saturday and some evenings. The county also has drive-up sites, drive-up testing in 4 locations. You can see what those are. And then we've moved to a new testing methodology where we are rotating the cities within Santa Clara County, and not including Gilroy and San Jose, where we have a permanent presence, but we are rotating the cities, doing one different one each day, and we do about 600 slots. The difference is there is an appointment required, and we've been able to fill those up, and we're evaluating how well that's working. That's Monday through Friday. And then you can see our 2 state-supported sites, Verily and OptumServe. And then next slide. I just wanted to give you, again, the schedule for all of the testing we're doing in the next 2 weeks. But you can look, for today, you can look on the top listing of sites, and you can see for today, Tuesday, it says Morgan Hill Council Chamber, appointment only, Tuesday, 9:30 to 4. So that's the city rotating site, and that's where we are today. And then we're very excited on the final slide. Okay. We're very excited because we know that we need to increase our testing even more. And so we are in the planning stage right now for what we're calling a large capacity drive-through site. We are looking at our fairgrounds for that site. We are in a planning process right now. And so it's in development. We hope it will be open this month. Again, no promises, but we're working very hard to make that happen. And it will be developed in phases. The first phase, we will most likely have scheduled appointments. It will be drive-through, and you can see under that A box, those will be all of the lanes where people will come through. We will have Spanish speakers and other languages, and we will even have a lane for people who are on a bicycle or who are on foot and don't drive in. In later phases, we plan to have much more in the way of non-appointment lanes, and we'll increase our capacity. If we open up all 3 modules, A, B, and C, or A, C, and B, we will be able to accommodate nearly 5,000 tests a day. But again, that's going to be down the road a bit. And we're looking down the road as the fall comes to be able to implement also the provision of flu vaccination and hopefully sometime in the future, COVID vaccination. So that's planning and process, but we're very excited and working with a lot of staff. And I will end there, although I just want to say thank you very much, and an extra shout out to the VMC nurses and staff who are doing the amazing work at all of these testing sites. We couldn't do it without them. So thank you to all of those staff. And I'll turn it over to Dr. Rudman.
Thank you so much. Thank you, President Chavez and supervisors. I'll give a presentation and update on our case investigation and contact tracing effort. Next slide, please. So I'm pleased to say that the county has achieved and actually exceeded our very ambitious goal of over 1,000 contact tracers and case investigators. We're at 1,065 trained and onboarded as of last week. And this workforce is made up of over 350 reassigned county workers, An almost equally large contribution of community volunteers and a smaller paid workforce hired newly for this work, as well as state disaster service workers reassigned to assist us. Next page, please. Also, our most recent metrics in this period, you'll see are actually more than double the number of cases that we reported back to you 2 weeks ago on our last update. Yet we still maintained the same relatively high success rates in our ability to reach cases and contacts. We continue to be able to attempt 100% of cases we receive if they come with any contact information at all. And then we are successful at rates of 78% of those cases ultimately and 71% of those contacts elicited, which is well beyond what we've seen reported out of similarly sized jurisdictions all over the country. We also continue to see around above 6% of folks requesting resources in order to be able to safely isolate a quarantine at home, and continue to work closely to refine our referral system to the Health and Human Services group running the COVID support team. Next slide, please. And our last contact tracing slide. Additional updates since the last report 2 weeks ago. We've made further strides that include improved scheduling to match our resources to our need better, and to launch a full clinical support team. This team provides clinical information and consultation both to the contact tracer team as well as to the cases and contacts themselves. They also provide clinical monitoring calls to our most vulnerable cases and contacts, enhanced coordination with the COVID support team for clinical evaluation in order to make sure that there are appropriate clinical supports when other supports are in place. We've also updated all of our procedures and job aids for tracers, continuing to refine and improve them. And we've launched just this week an expanded and enhanced training system that especially goes back to those who were onboarded earliest in our process and received shorter, more efficient trainings from the state. We've identified areas where we really think we can improve upon these trainings, including a lot of Santa Clara specific information and resources, really focusing on our county's values, focused information about racial and health equity and how that impacts the contact tracing effort, improved training on motivational interviewing, and some self-care resources for our contact tracers to make sure that they're able to stay healthy and safe while they're taking care of our community. That's it, and I'll pass it back to Dr. Kamal now, please.
Thank you, members of the Board of Supervisors. So I would like to just provide an update from the last presentation on July 21st. Next slide, please. So our hospital census has remained stable despite increased numbers of COVID hospitalization throughout the month of July, and this likely reflects a shorter length of stay that we had been seeing in the last month as well. We also received updated surge plans from each hospital, and this includes plans around staffing, around space, and around supplies. And we are in receipt of those and have reviewed them. We are pleased to announce that there are no further mutual aid requests coming to us for transfers from out of the county since the Imperial County transfers 5 patients a few months back. However, staffing continues to remain the challenge, especially in some of our hospitals. Remdesivir distribution is also limited, with allocations being determined federally. And finally, the distribution of patients is now skewing a little bit more towards the eastern and southern parts of the county, which is what we had seen back in April, unlike what you had been seeing in the last month. Next slide, please. This just shows our remdesivir supply and usage, and the sawtooth pattern of the orange bars reflects the weekly or bi-weekly distribution of remdesivir. So we get a bolus of vials at some periodicity. The green line shows the usage, and as we can see, the usage had gone up considerably, and that resulted in our stockpile going down. Both the usage and the supply has stabilized in the recent week or so, and we continue to monitor this daily, talking with each hospital's pharmacies about what they have and what they need. And we have a system in place to redistribute remdesivir as needed, and are pleased to announce that we are able to provide remdesivir to every patient who needs it. Next slide. This shows the current state of hospital capacity. The green parts of the bars reflect non-COVID patients. The red parts reflect COVID patients, and the blue parts reflect unused capacity. So our unused capacity is still about the same as it was before, with about a 70 to 75% occupancy rate, and all hospital systems have some remaining capacity. Next slide. This slide shows the current state of our PPE. All hospitals in our county have certified that they have enough PPE for the next 30 days. In addition, all hospitals except 2 have reported they do have an N95 reprocessing program in place, which allows them to use the N95 masks for even longer periods. There are 2 which do not have that, but are currently working actively on establishing that. Skilled nursing facilities have all said they do not have any urgent PPE needs. We continue to supply them through the EOC warehouse, with 13 skilled nursing facilities having filled requests in the last 2 weeks. And finally, our county warehouse continues to accumulate PPE for any further needs related to a surge in COVID or to the upcoming flu season. We still don't have the number of gloves we would like, but that gap has narrowed quite a bit, and we are expecting another 350,000 from the state in the next week or 2. Next slide. In terms of staffing, there were 2 hospitals which did report to the CDPH that they had a staffing need. We did contact these hospitals and resolve their concerns via the use of staffing agencies that the hospitals have in place. There are no skilled nursing facilities with any immediate staffing needs. Next slide. So we continue our ongoing, at least weekly, if not daily, engagement with hospitals and healthcare facilities. We have a scheduled weekly call with each hospital individually and have done so for the last 4 months. In addition, we often have off-cycle calls to discuss individual issues that come up. We also have weekly SNF and provider calls that are hosted by Public Health. We're continuing our series with the Hospital Council, with executive leadership focused on testing, on surge planning. This week, in fact, on Thursday, we're having a call regarding skilled nursing facilities transfers and supportive housing. And finally, we're still working on even more enhanced data feeds from hospitals so we can have even more granular data in real time about what's going on in hospitals and know how best to assist them in caring for our patients. Next slide. So, in summary, hospitals currently have sufficient beds, PPE, and staff, and we continue to engage with them to make sure that stays the case and trying to be proactive in identifying any needs and supporting them through multiple avenues of engagement. And we will continue to monitor the parameters and discuss with them how best to meet their needs. Thank you.
Hi, Betty Young, presenting on behalf of the Public Health Department and OLSC Community Health and Business Engagement Team, or CHIBET. Next slide, please. This slide reflects the measures that are being tracked on a weekly basis and will be shared with the board on a weekly basis starting this coming Monday. The Community Health and Business Engagement Team currently has 47 community health workers in various stages of hiring and onboarding. We will have 17 business engagement team members and 15 community health workers in the field starting this Monday, August 17th, making for a total of 32 CHIBET community health workers as part of the first cohort. Next slide, please. This slide represents our priority points of engagement defined by geographical region, disproportionately COVID-19 impacted communities, and referrals for engagement and business education. Next slide, please. We're very excited to start sharing our dashboard with the board next week once community health workers are deployed, and want to reiterate again how grateful we are for the support of the board, administration, and our community partners for their support in launching this very needed resource. Thank you.
Thank you, Betty. Michael Ballier, Director for the Department of Environmental Health and also the new branch director for the Community and Business Engagement Unit. Next slide, please. Just want to take this opportunity to provide a high-level overview of the structure of the branch, because it actually includes, and I like to say this group does and organizes a lot of the great work that's already being done both in the EOC and outside of the EOC. So we do an awful lot of coordination with a lot of the work that you've already heard about today. And so I'll go into some of the details here in the next slide.